That burning feeling when you pee, is it always what you think it is? Many people immediately jump to conclusions, but the real story is often more complex. Let's talk about urinary tract infections, or UTIs. Imagine your urinary system as a plumbing network. You have the kidneys that produce urine, the ureters, which are tubes that carry it down, the bladder, which stores it, and the urethra, the final exit pipe. A UTI is simply an infection anywhere along this pathway. Most commonly, it's a bladder infection, known as cystitis, or a urethra infection, called urethritis. If it travels up to the kidneys, it becomes a more serious condition called pyelonephritis. So, what causes these infections? The main culprit is usually a bacterium called Escherichia coli, or E. coli. This little guy normally lives harmlessly in our intestines, but when it finds its way into the urinary tract, it can cause a whole lot of trouble. Think of it like a neighbor who asks great in their own house but causes chaos when they wander into yours. Once inside, these bacteria cling to the walls of your urinary tract and start to multiply, leading to inflammation and those all-too-familiar symptoms. You probably know the classic signs: a constant, urgent need to pee, a painful burning sensation during urination, and cloudy or strong-smelling urine. Some people might even see a bit of blood. But here's something interesting. Symptoms can look different in men and women, while both experience burning and urgency. Men might also notice discharge from the penis. Women, on the other hand, often feel pressure in their lower abdomen or pelvic area. It's not always a straightforward diagnosis based on symptoms alone. Now for the big question: why do women get UTIs so much more frequently than men? It's not about hygiene habits, despite what some myths might say. It really comes down to anatomy. Here are the top 5 reasons. First, the female urethra is much shorter than the male urethra. For men, it's about 20 centimeters long, but for women, it's only about 4 centimeters. This gives bacteria a much shorter distance to travel from the outside world into the bladder. Think of it as a short commute versus a long-haul flight for the bacteria. The shorter trip is just easier. Second is proximity. The female urethra is located very close to both the vagina and the anus, which are natural homes for bacteria, including our friend E. coli. This close geographical relationship makes it easier for bacteria to accidentally migrate from one area to another. It's like living next door to a troublemaker. The chances of them wandering over are just higher. Third, sexual activity can play a role. The physical motion can introduce bacteria from the surrounding skin into the urethral opening. This is why peeing after intercourse is often recommended. It helps to flush out any bacteria that might have been pushed inside before they can set up camp. It's a simple mechanical cleansing process. Fourth, certain types of birth control can increase the risk. Specifically, diaphragms and spermicidal agents can alter the natural bacterial balance in the vagina. This can allow harmful bacteria like E. coli to flourish, increasing the likelihood that they will find their way into the urinary tract. It's an unintended side effect of changing the local environment. And fifth, hormonal changes are a major factor, especially during menopause. When estrogen levels drop, the lining of the urethra can become thinner and more fragile. The vagina's pH also changes, disrupting the healthy balance of bacteria. This creates a more favorable environment for UTI-causing bacteria to thrive and makes the urinary tract more vulnerable to infection. But what if you have all the symptoms of a UTI yet your urine test comes back negative? It feels like a UTI, it burns like a UTI, but it's not. What could be going on? It turns out, there are several conditions that can mimic a UTI perfectly. We'll explore those mysterious lookalikes in our next video. Thanks for watching, and don't forget to subscribe for more health insights.